Navigating the health insurance system can be a daunting and confusing problem for millions of Americans searching for the best way to protect themselves from skyrocketing medical costs. Dr. Ackerman is one of the First Coast's leading oncologists. He joins us every Friday to talk about important health issues such as this. And today he is joined by a special guest. Welcome, gentlemen. Thanks for being here.
Thank you for having us.
And Dr. Ackerman, introduce us to who you brought with you.
So today, Casey, we're going to talk about navigating health insurance. Lots of changes with the Affordable Care Act and all that. So I brought with me a good friend of mine. His name is Matt Heinle. He's a healthcare attorney, and he is an expert on healthcare issues. Health insurance, I see patients all the time who are very confused. They lost their policy, they're getting a new policy, they hear all this stuff on the news about the Affordable Care Act. So it's very, very confusing. And so patients, they're always asking my advice about coverage. So I thought I'd bring Matt here today to help clarify the options that people have.
I mean, it is very confusing. So I don't know if we can get this across in 5 minutes, but we're sure going to try to at least dive into it and put some clarity on some things that have been very confusing for a lot of people. Let's start out simply with, and if you can't explain this, simply, what is the Affordable Care Act? Put it into layman's terms.
Okay, so Obamacare, how it's commonly referred to,
right.
It's 1,000 pages long, very, very complicated. But in terms of for individuals, starting in 2014, individuals must have health insurance. If they don't have health insurance, then they're subject to a financial penalty unless they qualify for one of the many exemptions out there that exist. What it also does is it forces health insurance plans to provide preventative care, wellness checks, cancer screenings, so patients can go to see Dr. Ackerman and his colleagues under the plan. So those are really the two primary changes in the healthcare marketplace because of Obamacare.
Right, because of the requirement to get health insurance. Every person must have insurance. Okay, what are the ways that individuals and families can apply for health coverage? Because there's been a lot of confusion about, and we don't need to get into the weeds too much, but about the state-run exchanges, be the federal exchanges, whether I get it from my employer, can I not get it from my employer if they're not going to be covering me anymore, part-time, be full-time, kind of break it down how people can get insurance.
Absolutely. If you're employed and you're fortunate enough to have health insurance offered to you through your employer, I recommend get it from your employer. It's typically the fastest way, the cheapest way to get health insurance. A lot of employers are dropping health insurance now because of Obamacare. So what you can do is you can pick up the phone, go on the website of the many insurance companies here in Florida, and buy directly from that website. The problem with that is you're not going to qualify for any federal subsidy if you go directly to the insurance company. But insurance companies at any time during the year sell insurance to individuals.
Well, and people don't realize that you can go directly to the insurance company and get something, so that's an option.
I'm sorry, but a lot of times they're going to be more expensive, but maybe better options than what's provided for in the exchange. Florida does not have their own state exchange. It participates in the federal exchange, but you can go to the exchange during open enrollment, which begins November 15th for 2015. So in a few months, people can go online to healthcare.gov and buy the policy that they choose through the exchange.
Okay, what has been the impact, in your opinion, on the Affordable Care Act here in the state of Florida?
Florida is #1 in terms of the number of individuals who bought insurance through the federal exchange. Just under 1 million people did. Interestingly, 91% of the people in Florida who bought insurance through the exchange qualified for one of the federal subsidies. So only 9% of the Floridians who bought insurance through the exchange are actually paying full price for it. Now, whether that continues in the future is to be determined. It just depends on who's paying for what and how the subsidies come through.
Right, exactly. And the subsidies are taxpayer-funded subsidies. So the question is
Correct.
How is this going to be able to function if there's only a few people who are paying full price and all these people are getting subsidies? Is this going to kind of collapse under its own weight sort of thing? So that's still TBD with going forward with health care. Dr. Ackerman, what are your recommendations for health care? And what do you tell your patients who come in? Obviously, you're an oncologist, so it might be different than a general practitioner, but what would you say to somebody who's watching?
Well, health insurance is very important. It's important to have. Without health insurance, you don't have access to care that you do when you do have health insurance. So you want to ensure that you have access to care. And access to care doesn't just mean care when you're sick, but access to preventative health screenings and those sort of things. So it's very important that people have that coverage. It's not good just to go bare and pay as you go, because when you do that, you're not going to get the health screenings that are very, very important. And as an oncologist, these health screenings diagnose cancer early and make it so we can cure cancers. So I also tell people to utilize resources available to them. There's healthcare navigators, there's social workers. We provide them in our office. We see plenty of patients that are underinsured, or whose insurance isn't really working well for them. So we have social workers within the office to help these people navigate and help these people get engaged and enrolled in a good policy that's right for them.
All right, Dr. Ackerman, Matt, thank you so much for
Thank you
joining
very
us.
much.
Appreciate the guest appearance.
Absolutely.
On
Thank
on
you.
the health segment, and thanks again to Dr. Ackerman for coming on, providing the information, and of course sponsoring the segment. And if you want any information from Dr. Ackerman, if you have any questions about this topic, about the health insurance exchanges, anything that you may have, you can go to Dr. Ackerman's Facebook page, facebook.com/First Coast Oncology.